Hi, and welcome to Make Up Your Mind with Natasha LaFay. I wanted to share this video with you guys. I was asked to speak at the H.O.S.A organization meeting at Fossil Ridge High School here in Fort Worth, Texas, and I just wanted to share with you guys some great questions that the students had to ask. Enjoy! With my client, I went to Michigan State University for my undergrad. I'm originally from Detroit, Michigan. So I got my undergrad. I initially started as a pre-med major, and I quickly realized that was not for me because I am not a fan of the math and sciences. So in my junior year, I took an introductory to psychology class, and I fell in love. And that is when I officially switched my major to psychology. Since then, I've obviously moved to Texas. I worked in the healthcare field for about 16 years doing credentialing and staffing for medical doctors and healthcare professionals. So basically getting their paperwork together for them to be eligible to work in hospitals. But I knew that I wanted to get back to what I was originally interested in, which is counseling. So I ended up going to Liberty University for my master's program. I did my master's program online because I was still working full-time while I was also doing my master's. Since that time, I've had several different experiences. I've worked private practice as well in a hospital setting doing mental health counseling. So right now I am licensed as an LPC, so a licensed professional counselor, as well as an LCDC, so a licensed chemical dependency counselor, and then I'm also certified as a life coach. So I try and cover the full spectrum. Couple things as far as the differences between the field, and I'm not really sure kind of what your makeup is, what you guys are interested in. But private practice is a very individualized setting. So you're sitting down talking one-on-one with clients, creating a treatment plan, working towards specific goals. And that can be a longer process, right? So clients can come for 6 months. Some clients will come up to a year or two, just depends. So that is kind of a slower paced process. I do our substance abuse group. I currently work at a practice called Grace Counseling. It is located in Louisville, and they also have a location in Fort Worth. And I do their substance abuse group. So it is a intensive 16-week program that helps people to work towards a lifestyle of recovery. So that's another facet. And then I also work in a mental health hospital. I worked at UVH Hospital in Denton, Texas, and I worked on our PICU unit, which is our psychiatric intensive care unit, where I saw a lot of bipolar, schizophrenia, lots of psychosis, and then people dealing with intense suicidal ideation. So it was a very high level of care, very intense. Oftentimes didn't know what you were walking into when you walked in the door each day. But it did give me a full range of experience because in private practice, you don't see those high level cases, right? So I do recommend, if that's counseling is something that you're interested in, I would say, one, you can get your clinical hours very quickly working at a hospital. And then you also get a range of experience and knowledge in the field. So if you do decide to go private practice, you'll be knowledgeable and can be aware of diagnosis, creating treatment plans. So it gave me a high level of skill and understanding as far as just overall mental health. I feel like I'm talking really fast. I developed my company. I do have my own private practice. It's called M.B.S. Whole Health. M.B.S. stands for mind, body, and spirit. So I really do look at mental health from a holistic standpoint. So I understand it's important to take care of your mental health, but you also have to take care of your spirituality as well as your body. So making sure that you're focusing on those three components. So I do virtual counseling. So branching out, I do in-office counseling, and I also do virtual counseling. I find that individuals who are not comfortable with coming to counseling, they've never been to counseling before, maybe they have extremely hectic lifestyles and they're not able to get into a counseling office. So it's just another avenue. If you're interested in doing counseling, there are expanding ways that you can reach people. And then I also do YouTube. So I have a YouTube channel where I do makeup and mental health. I merge those two together. So I spend time in the morning doing my makeup while I'm talking about mental health issues. So the whole point of that is really trying to meet people where they are. We know that we spend a lot of time on social media and we spend a whole lot of time on YouTube. So really trying to take those two skills. People are interested in makeup, they can also come, but it's really trying to normalize the conversation about mental health. So really trying to make it a calm, casual environment to talk to people about what they may be struggling with, may not be comfortable with, but also meeting them in a space where they're comfortable. So that's my focus, growing my company, M.B.S. Whole Health, and then also doing things like this. I do a lot of outreach in churches, trying to teach them how to merge faith and mental health, because I think that is something that's very important in normalizing the mental health conversation. And that's kind of my overview. I don't know if you guys have any questions specifically as far as what I do, my experience, what you guys are interested in.
How do you deal with handling all those like really tough patients? Because how did it affect you and how for you to deal with it?
It was, when I was working in the hospital, honestly, it was really difficult. Like I said, you saw people at probably their worst level, so very high level of psychosis. A lot of them were extremely aggressive, extremely violent. So anytime you're in a mental health field, I think it's critically important for you to take care of your own mental health. So as a therapist, I have a therapist to make sure that I am in a strong mental place to be fully present for my clients. So I think it has to be a balance. For me, I had to teach myself when I left the hospital, I have to leave work at work. And then when I come back, I can be fully there for my clients. But yes, it was extremely intense, a lot of anxiety, because you never know when someone can react in a violent way and still trying to be therapeutic while also protecting yourself.
Do you still see like that level of like aggression and stuff when you're like in an office setting?
No, not really. I do still see clients who deal with bipolar and schizophrenia, but typically they're medicated, so they're not at that high of a level. But I think it has trained me to be able to be aware of when I see those signs, and I recommend you need to go and check into a hospital to get you stabilized. So oftentimes in an office setting, you won't see that high level because most times they're already kind of on medication, stabilized, or if they're at that intense level, they'll be going directly to the hospital.
Have you ever recommended a different therapist?
I do think, and I tell my clients this too, not every therapist is going to be a good fit, and it's up to them to make sure that they are getting what they need out of the therapeutic process. So if I find that I've been working with a client and we're not making any progress, or I feel like someone else is specialized in what their needs are. So I don't specifically treat people who deal with eating disorders. That isn't my specialty. But I do know clinicians who that is their specialty. So I don't want to ever waste the client's time. The whole goal is to get them to a healthy place. So I think it's perfectly okay to refer a client out to make sure that they're getting what they need.
That's cute.
Yeah, pretty creative, right? So I really enjoyed that. That is definitely a relaxing time. It's very therapeutic for myself as well.
Do you get doctors a lot?
Doctors as far as clients?
Yeah.
Sometimes you can get a whole gamut. I mean, I've had public officials, attorneys, doctors. I don't think anyone is immune from needing help from mental health support. So it's important, whatever their title is, to create an environment where they can feel comfortable.
How long is like the educational process to become a mental health counselor?
Yes, so the master's program is a 2-year program. While you're in your master's program, there is a section called a practicum, where you start to see clients while you're still in your master's program, which can be extremely scary because you feel like you don't have all the tools, you don't know everything that you need to know, but they give you that training. So for me, I had to do 100 hours for my practicum, so 100 face-to-face client hours. And then towards the end of my master's program, I had to do a 600-hour internship. So I'm seeing clients 600 hours for that training. So when you're done with that, you have to take an exam. It's called the CPCE. It's a counselor proficiency exam in order to graduate. When you're done with that, then you have to study for your licensure exam. For the state of Texas, it's the NCE, the National Counselor's Exam. Once you take that, then you get your LPC intern license. So you are licensed, you're done with school, but you're still considered an intern. So you have to practice for another 2,000 hours under supervision. And when you're done with those supervised hours, then you can apply to be fully licensed as an LPC. For my LCDC license, that was a little bit easier because I'd already finished all the education. And because I was already done with school, I was already licensed as an LPC intern. All I had to do was take the exam, and then I got my LCDC license. So it can be a long process, especially considering how long you have to practice as an intern and under supervision, and oftentimes you have to pay for that supervision. So it's it can be a tedious process, but once you're done, you are fully able to open your own practice. You can practice on your own in whatever kind of field you would like to do. So if it's in a hospital setting, private practice, etc.
So what would you give advice? How do you know when you need to take a mental break and focus on your mental health versus I gotta push and do things?
That's a very good question. And I think a lot of times as healthcare providers, we can get a lot of compassion fatigue where we're so focused on being there for our clients that we forget that we have to take care of ourselves first. So for me, I can tell if I'm feeling extremely stressed, I'm feeling distracted where I can't fully be present with my clients, if I'm exhausted and I'm struggling to keep up with the administrative side, then it's like, Natasha, you need to take a break. And allowing myself to actually take a break and not feel guilty about it. Because if you are not well, you can't really be help to anybody else. So I think you have to be very aware of your own body. Listen to your body if you're feeling like, I don't want to get out of bed. And counseling is something that I love. But if I start to feel like I don't want to get out of bed and go to work, it's time for me to take a break. I see adults, so 18 and up is my kind of area, so I can see 18 up to whatever. For me, like I said, my specialty, I don't feel because I have children, so it's difficult for me to counsel children. That isn't my area. So I will say, I will see 18 and up, I feel comfortable with that, but I don't do any adolescent or children.
Okay, so when you were in school, did you study to be a particular type of specialist, or is that just after?
It's after, and I think that's why they make you do so many hours of internship and training, because during that time, you need to get your hours, so you're open to seeing anybody. So as you're working with different clients, different disorders, different things that people are working with, you can find, okay, this is something that I feel comfortable with. This is something that interests me, so I'm gonna focus on this area. So it helps you to kind of learn what your niche is.
What kept you motivated to pursue this?
For me, it was very personal. I've gone through a lot of life difficulties, and when I was growing up, especially being an African American, no one talked about therapy. No one really talked about their issues, their problems, what was going on, and I became that person that a lot of my friends would come to for advice or for me to listen, to be that support. And I found that that was something that I enjoyed. And as I got older, I realized that there was really a need for African American women to be in So I think that for me, that was my passion, wanting to really be present and help people, and knowing that there were a lot of people who didn't have that. And it was something that I wish that I had as well growing up.
So like when you're providing care, is it like a combination of like medication and counseling, or is it just mostly counseling?
For my specialty, LPCs, so licensed professional counselors, and LCDCs, master social workers, we are not allowed to prescribe any medication. So anytime that I see a client and I feel like they would benefit from medication, I refer them out to a psychiatrist.
I forgot what I was gonna say. Don't remember a second. But I was gonna say that like for a while I've been considering becoming like a psychiatrist is like what I want to do. But since those are typically like usually the medicated patients, do you think it gets like scary because it's like more levels of aggression? So that's like my main like thought and doubt.
It depends on what area you want to work in. One, I would say that psychiatrist is definitely needed. I think that from my perspective, it is very difficult to get a client in with a psychiatrist and they're saying, oh, we have a 4-month wait to get a new client in. So I think that is a field that definitely needs more providers. In regards to the level of aggression, I think if you're seeing someone in an office setting, a lot of times they aren't at that high level. I think that psychiatrists who work specifically in a hospital setting, definitely that's something that they need to be aware of, that they could be getting themselves into. But it just depends on what kind of environment you want to work in.
Other than the medication, what are the differences between a psychiatrist and a therapist?
I always tell my clients, psychiatrist is similar to going to your primary care doctor. So they'll come in, they'll do their initial intake, which is extended maybe 45 minutes or so, where they ask you a bunch of questions and give you a diagnosis. But any session after that, it's typically they're checking in. How is your medication working? Are you having any side effects? Do we need to make any adjustments? So it's just like going to the doctor for a checkup. When you go to a therapist, you get 45 minutes to 50 minutes to an hour to sit down and actually talk about your issues, develop some good skills to help you learn how to work through your problems. So I think medication has its place, but therapy gives you that space that you need to actually work through things and learn some skills, so that for some people, they don't have to be on medication for the rest of their lives, or they can get themselves to a stable place, then they won't always need to be on medication. Yeah, I think that's why I'm so passionate about what I do outside of the therapist's office, as far as going out into the community, talking about mental health, using social media platforms, YouTube, things like that, to normalize the conversation, because I'm really trying to push against that stigma. I think that nowadays in the media, I think they're doing a better job, where we're starting to see therapists on TV, where, you know, people on TV shows are going to therapy, people are talking about it more, celebrities are talking about going to therapy more. So I think it's starting to kind of destigmatize that, but I think it'll definitely take time and people being more willing to be open and honest about what they're struggling with.
Thank you again, Fossil Ridge High School H.O.S.A, for inviting me to speak. I truly enjoyed you guys, and I look forward to seeing you next year. Make sure that you guys, whoever's watching, hit that subscribe button as well as the notification bell, so that you'll know anytime that I upload, and you'll join me here for the next video. Have a blessed day, and I'll see you